Hi, and welcome to Dialed In, helping veterans take control of their healthcare. I'm Beth Doyle, a veteran of the U.S. Air Force and an education specialist with the VA National Center for Ethics in Healthcare. VA patients have the right to make decisions about their own healthcare, but in case they become too ill to make those decisions, VA encourages every veteran to choose someone ahead of time to be their healthcare agent, the person who can make healthcare decisions for them. If you've been named as a healthcare agent, you'll act as your loved one's legal representative when it comes to making healthcare decisions. Dr. Cynthia Geppert is a VA physician and healthcare ethics consultant.
Being named as a healthcare agent can be quite a responsibility, but it also is a real privilege because it means your loved one has confidence in your ability to make decisions for them. And that's what you're being asked to do, is to make a decision the way your loved one would if they could speak for themselves at a time they're not able to voice their own wishes and preferences. You can do this because you know the person, by knowing their values, by being with them, by talking to them.
Dr. Jill Lowry is a VA psychologist and an ethics policy consultant with the National Center for Ethics in Healthcare.
Several years ago, my parents sat down with my two brothers and with me to tell us what kind of health care they would want if they ever got too sick to make those decisions for themselves. They named me as their backup healthcare agent in case they can't make decisions for each other. They told us all flat out that they think that I'm more likely to follow their wishes than my brothers are, and we all had a good laugh about that one.
As a healthcare agent, your task will be to make healthcare decisions based on what your loved one would do, even if these are not decisions that you would make for yourself. So it's really important to sit down and talk with your loved one about their preferences before they become too ill to tell you what those preferences are.
We had a really great discussion about what was important to them, and I'm really glad that my brothers were there and heard the same things that I did, so that if the day comes when decisions have to be made, there won't be any disagreements or hard feelings.
Dr. Geppert discusses what some of those decisions might involve.
Would the person want to be resuscitated if they stop breathing or if their heart stopped? Would they want to be on a breathing machine? Would they want to have artificial nutrition and hydration? What would they want if they can't recover? What would they want if they can? These are the kinds of decisions that you might be asked to make. And what I've seen is when these conversations don't happen before a healthcare crisis, often the care the patient didn't want happens. Often someone they didn't want to make decisions for them ends up being the decision maker. So talk to the person who appointed you as a healthcare agent as soon as possible when you're appointed, and don't wait for a crisis.
Your loved one might have completed a living will, a type of advance directive that specifies what kinds of medical treatments they might or might not want in different situations. So you may wonder why the medical team still needs your help as a healthcare agent. Dr. Geppert explains why the living will isn't enough to guide them.
It's because it can't possibly cover all the many decisions and possible choices that you might be asked to make for your loved one. Think of this as a map. You're the one who's reading the map and helping the healthcare team understand what this unique individual that you care about would want in different situations. What are their values, their beliefs, their experiences? What is their life story that would help you and the treatment team know how to understand and make decisions based on the advance directive?
It's important to always keep in mind that you're not alone.
It's quite a responsibility, but your VA healthcare team is here to help you. The treatment team is there, the primary care provider, a chaplain, ethics consultation service, and a number of resources on advanced directives and healthcare agents that the VA National Ethics Center has available.
Finally, if you can, check in with your loved one from time to time to make sure you still understand their healthcare preferences. Dr. Jill Lowry.
I have a copy of my parents' advance directives in case I need them someday, and I check in with them every so often just to make sure that their wishes haven't changed. As hard as I know it would be to have to make decisions for them if they were too sick to make those decisions for themselves, I know it will be a lot easier now that I know what they want and what matters most to them.
To learn more about choosing a healthcare agent and what it means to be one, or to download a VA Advance Directive, visit www.ethics.va.gov/forveterans.asp. Dialed In is produced by the Department of Veterans Affairs National Center for Ethics in Healthcare.